Welcome to Chapter 13, Psychological Disorders from the textbook Introduction to Psychology, Gateways to Mind and Behavior by Dennis Kuhn. In this video, we will cover the complex and diverse world of psychological disorders, gaining a deeper understanding of various mental health conditions and their impact on human life. From exploring the diagnostic criteria for different disorders to unraveling the intricacies of treatment approaches, this chapter offers invaluable insights into the multifaceted nature of the complicated human brain. Have you ever wondered what makes a behavior or pattern of thought abnormal? When we talk about psychological disorders, we're referring to patterns of thinking, feeling, or behaving that are deviant, distressing, and dysfunctional. But defining abnormal is not as simple as it sounds. We usually consider 5 characteristics: distress, maladaptiveness, irrationality, unpredictability, and unconventionality, combined with statistical rarity. These features help us identify disorders, yet it's important to remember it's not just about being different, but about whether these differences cause problems for the individual or those around them. Now that we know what a psychological disorder is, how do we categorize them? Well, mental health professionals use a tool called the Diagnostic and Statistical Manual of Mental Disorders, or DSM for short. The DSM is like a dictionary of mental disorders, each with their own set of diagnostic criteria. It allows professionals to classify disorders based on observable symptoms, ultimately helping them to diagnose and treat individuals with mental health issues. Within the DSM, disorders are grouped into categories. For instance, anxiety disorders include conditions like panic disorder and obsessive-compulsive disorder, where fear and anxiety are dominant. Mood disorders like depression and bipolar disorder involve significant changes in mood. Personality disorders such as borderline personality disorder are characterized by enduring patterns of behavior that deviate from societal expectations. The DSM helps professionals diagnose and treat disorders, but remember, it's not as simple as checking off a list of symptoms. So, what causes these disorders? Well, let's delve into the biopsychosocial model of mental illness. This model suggests that disorders aren't caused by a single factor, but by a complex interplay of biological, psychological, and social factors. Biological factors can include genetics, brain chemistry, and even physical illnesses that affect the brain. Psychological factors, on the other hand, can encompass things like our thoughts, emotions, and learning experiences. Lastly, social factors look at the impact of our environment, which can include our relationships, socioeconomic status, and cultural background. It's like piecing together a jigsaw puzzle, each piece contributing to the overall picture. And just as you wouldn't treat a physical illness without understanding its cause, the same applies to psychological disorders. Knowing whether a disorder is more influenced by genetics, personal experiences, or environmental factors helps therapists and psychiatrists determine the most effective treatment approach. Understanding the cause is just as important as identifying the disorder as it guides the treatment process. Once a disorder is identified and understood, how do we treat it? It's a question with answers as diverse as our minds are unique. Treatment can range from medication to psychotherapy and even lifestyle changes. It's important to remember that there's no one-size-fits-all solution. A tailor-made approach is often the key, as what works wonders for one individual may not be as effective for another. Treatment is a journey, often requiring time and patience, but with the right approach, individuals with psychological disorders can lead fulfilling lives. To sum up, we've explored how psychological disorders are defined, classified with the DSM, and understood through the biopsychosocial model. We've also examined the tailored approaches to treatment. Join us in our next video as we venture into the enlightening realm of psychological therapies, unraveling the diverse approaches and techniques used to address psychological disorders and promote mental well-being. Remember, understanding and compassion are vital when dealing with psychological disorders. If you or someone you know is suffering from depression, anxiety, or have thoughts of suicide, help is only a phone call away. The National Suicide Prevention Lifeline is 1-800-273-8255. With knowledge comes the power to help. Until next time.